because it's been one positive case, and due to contact tracing in winter sports, that's what local health departments have required. So I think our case numbers going up. Can you pinpoint it on one specific area? I think it's a lot of different areas. And we knew that we would have to manage some positive cases when more sectors of our society have reopened, when more face-to-face learning in schools has really reemerged here in 2021. And that I think is just a very honest assessment. But again, if sports is the key, I would just simply ask the question, well, what is Wisconsin, Indiana, and Ohio doing to play and continue their athletics without seeing the increases that we've had in Michigan?
Kind of leads into this next question. What's the MHSAA's response to changes in Ohio's quarantine policy, which doesn't require athletes in spring sports contact trace from a classroom setting to quarantine?
So I'm not going to speak much on the specifics of Ohio's approach because I don't have that information at my fingertips. I can share that probably the biggest challenge with winter sports has been contact tracing. You've got some county health departments that are handling this in different ways. In some cases, it's been neighboring health departments. In one county, it's a 14-day quarantine for anyone who participated in the contest to where someone later had a positive test. And then you've got other very close localities to where their quarantine has been 10 days. We've been told by our schools that in some respects, they've contacted their local health department, and depending on what staff person you talk to, you might get different answers as well. So I understand our local health departments are overwhelmed with the number of cases and the number of contact tracing that has to go on. I can tell you that our school administrators who have had to go back and contact trace, whether it's been through the academic day, whether it's been through all sorts of extracurriculars, that has been a real challenge. And, it'd be wonderful if the CDC would give some clear guidance that with, all education related positive cases, here is the contact tracing requirements in the timeframes, or if nothing else, even within our state, so that each local health department was handling that in the same way. I just know that's created a lot of confusion for many of our schools, just getting different answers based on either the part of the state that you're in or even the individual that you were working with.
You expressed last month that the new MDHHS director had good communication and dialogue with the MHSAA. Has that dialogue continued to be positive since winter sports have resumed?
Yes, we are very thankful to Director Hertel for the really the improved communication, the fact that we're able to share information and things that we're seeing, things that we're hearing from our schools, and that has gone vice versa. So no, we're just thankful that the communication continues to be improved over what it had been.
Does it make it easier, and how much easier, that there will be a limited number of winter sports participants teams remaining come April 2nd?
It will certainly make it much more efficient. Again, we're talking with winter athletes, we're talking less than 2,000 kids, and half of that 2,000 have been testing on a regular basis going back to February. So the lessons that we've learned going back to January through testing is certainly the bigger the testing pool, just the more challenges you're going to have in terms of logistics of getting tests and the recording and the reporting and just, the individuals needed for that. And again, that's why we're really looking forward to learning more about what the expectations are going to be with spring, because those are going to be in many of our schools quite significant numbers, and we'll see what that guidance on spring leads us here to.
Will testing override the current contact tracing protocol that is knocking teams out after playing a team with a positive test?
That we don't know what that answer is going to be moving forward. I can tell you that in wrestling, when a wrestler has had a positive case, even though all other wrestlers have been testing, the local health departments have still been enforcing either a 10-day or a 14-day quarantine period, depending on what they were doing. So at least up to this point, testing has not superseded the quarantine or the pause requirements. So until we get information to the contrary, we would expect that would be the approach as we keep going forward.
Spring sports are still set to start March 22nd.
All practices for spring will start next week. One early break that we're catching is it looks like we are getting a bit of an early spring. Even checked earlier this week. Marquette, Houghton, and Calumet are all talking temperatures in the 40s next week, which for a lot of our teams, whether it's a track team, they're going to be able to get outdoors. And we all know that when it comes to COVID, there is less risk when you've got groups outdoors versus indoors. So, with the start of spring next week, we're just hopeful that as many teams as possible can be outdoors right away on that first day of practice.
Will the MHSAA's game cancellation rescheduling policy change with anything said today?
No.
Do you feel this is trending in the direction of another shutdown? There are some coaches who are concerned about that.
That we haven't gotten any of that indication yet from MDHHS. I think when you go back to the experience of the pilot testing program in January, which included indoor sports, which included contact sports, I think that data does show that sports can be done and it can be done safely. So that has been what the data has continued to show. I realize that schools have reported more positive cases. Again, as I mentioned earlier, if you're part of an athletic team that gets reported and recorded, our schools knew that when you brought kids and staff back for in-person learning, we would have more positive cases until we reach herd immunity, which everybody's talking is that magic 70% vaccination level. So we're continuing to manage the positive cases, continuing to follow all of that local health department guidance, and that will be what we continue to do here as each week goes by.
Any concerns about having enough tests to consistently follow through on increased testing?
What we've heard from MDHHS is they have the testing capacity is available. We have been encouraging our schools, not just the requirements in wrestling, but any other winter teams over the last several weeks to test, to track your kids. And we've been told from the health department that testing availability is not an issue. And again, those are provided to schools free of charge, which is really a good thing to keep as many people safe as possible.
Do you get a sense the governor is considering pausing winter tournaments and delaying spring at all?
Have not gotten that sense at all. Not speculating, just simply stating we have not been told that by either of those offices today.
Baseball and softball are more socially distant. Will players need to wear masks in those sports?
So we're still trying to get some more answers when it comes to masks in spring sports. Really, all but two of our spring sports are non-contact. Boys lacrosse is a contact sport, as is girls soccer. Girls lacrosse, different playing rules than boys lacrosse, not a contact sport. And you could even make the case that boys lacrosse, while a contact sport, is much different than football. The contact is really from a distance of a few feet away. It's generally the contact is with a stick, different than the hand-to-hand, face mask to face mask contact of football. So those two contact sports would require to be masked. A sport like tennis and golf, and even track and field, to where you're able to exercise outdoors, keeping 6 feet of distance, that masks are not required. Track and field is another sport other than a relay, to where you've got occasional and fleeting seconds with teammates, that there's never a time in a track meet to where you're face-to-face with an opponent. So we'll continue to really take our spring on a sport-by-sport basis. And again, we'll follow what MDHHS requires when it comes to masking. In the original question, baseball and softball, does a catcher get treated differently given their proximity to the hitter than, say, the left fielder does, who is out there covering, I won't say acres, but an awful lot of green grass around them when they're out playing defense.
We'll do three more, Mark. Do you disagree with Governor Whitmer and the MDHHS's recent statements that youth sports is creating an uptick in cases in the state?
I think there's a lot of things, as I mentioned earlier, that have been reopened and re-engaged over the last several weeks. Certainly there have been more positive cases in our schools and kids who have been on athletic teams. Listening to a lot of our school administrators, there's still some skepticism that this is being transmitted during a basketball game or practice. And it's more likely when you're getting kids who on a Friday or a Saturday night after the game, after practice, who are hanging out in social settings. That's something we've continued to hear over and over from our school administrators. And again, I point you to the success of our 3 border states who have been playing winter sports going back to November. They have not seen the increases that we have recently. So epidemiologists or folks who are tracking that more carefully, I think could speak more to that topic.
Was the MHSAA aware of this possibility before this morning?
We were hearing that yesterday that there could be some additional guidance coming, and it could mean some expanded testing. But in terms of the details, those are all things that we've learned here during the day today.
Last one, just your thoughts for teams and players who were forced to shut down and miss tournament play. How tough is that for those teams and players to miss the postseason experience?
Awful. It's awful. The reason that we have been advocating for safe participation going back to August is the fact that we think that kids deserve seasons and kids deserve closure of those seasons. We had some individuals going back to the fall to where they were not positive themselves, that they had a connection to a different positive case that due to quarantining, they missed, for example, the regional round in a sport like cross country, or missed the regional round in a sport, or couldn't come back for the tennis finals that they qualified for. What's really been difficult is for our winter teams that have had to quarantine because an opponent on another team had a positive case, and the county health department's approach has been, well, anyone who was in the game, regardless if you were within 6 feet of any individual, that they're just quarantining the entire team just out of an abundance of caution and safety. That's been really tough for some of our schools. We've worn masks, and we're hoping that when you went back and did the contact tracing, that would be part of the elements that would be considered. But whenever teams are again, the timing here is everything, and is teams who have had to quarantine or pause within the last week, and what that's meant for the tournament experience, it's been heartbreaking. I also know that we've had some schools that have voluntarily paused or stopped playing games just to give themselves, for example, a basketball team, aware of several basketball teams that did not play games this week, just for the concern that they could play an opponent that might have a positive case, which could then have some implications for them when it came to quarantining and contact tracing. So these have not been easy days for anyone in high school sports administration. There have been challenges here in the building, but the challenges have been far greater in all of our schools, and just can't thank our athletic directors, our coaches, our kids and our parents enough for the way that so many of them have tried to do the right thing, have followed all the expectations, have done exactly what's been asked. And we're just hoping that those who have done all the right things, that they're going to be able to reach their finish lines here over the next 3 weeks.
Thanks, Mark. Thanks, everybody, for joining us. If you need a copy of this emailed to you, you can get with either myself or Jeff Kimmerly. My email is john@mhsaa.com. Jeff's is GEOFF@mhsaa.com. So thanks again. Thanks, Mark. Thanks, everybody, for your questions, and enjoy the rest of your Friday.
Thanks, John. Thanks, everybody. Appreciate it.